Okay, good afternoon, everybody. Thank you for joining us today. We are going to get started. I wanted to let you know that we are live streaming on Facebook at this time, and we are also recording this webinar via Zoom. If you're joining us on Facebook, please use the chat box on Facebook for any questions you might have. If you're joining us via Zoom, please use the chat box on Zoom to ask any questions. At the end of this webinar, we'll have a short poll that we'll launch. If you could please participate in the poll so that we can get your feedback, that would be great. I'm going to take this opportunity to introduce you both to Katrina Ringrose, a program director working for Disability Rights Maine, and attorney Ariel Linet, also works for Disability Rights Maine. And they're going to talk to you a little about in-home supports and how to navigate them during this time of emergency, but also just some pointers on how to navigate them in general. So I'm going to turn it over to Katrina and Ariel. Thank you, ladies.
Thank you so much, Carrie. And actually, just a quick question for you, because I don't know if we covered this part. If folks want to ask questions at some point, did you say they have to use the raise hand feature?
No, they can do the chat box or the question and answer box, and I'm monitoring that on Zoom. And then on Facebook Live, Dylan's monitoring the chat box. So you guys don't have to monitor it. I will keep track of all the questions, and I will make sure to get your questions answered. If I can answer them without interrupting you guys, I will do so. If I feel like you need to answer them, I usually find a good spot to try to natural pause to try to address the questions and just check in at the chat box, and then we'll do that again at the end.
Sounds perfect. Thanks.
Yeah.
Great. Well, hello, everybody. I'm Ariel, and there is Katrina somewhere on your screen. We're very excited to be with you, and this is the first time we've done anything quite like this. So you may have to bear with us a little bit, but we've decided that this is going to be an informal and friendly group. So we hope you feel that way too. So I'm going to share my screen with you all and get to the PowerPoint. So we're talking, as Carrie said, we're talking to you today about children's home and community-based services during the pandemic, and some of it will be crossover for during any time, assuming that there is a post-pandemic time, which I'm sure there will be. So this is our contact information. I've shared the PowerPoint with Carrie, and she's going to share it with you and put it on the website. There are a bunch of links and other resources embedded in the PowerPoint, so don't worry, you will get access to that as well as this contact information. And then, of course, there's the disclaimer at the bottom, just that this is for educational purposes. It's not legal advice. We're not creating an attorney-client relationship with those of you who are watching this presentation. So I have some interactive elements built in. If you would like to go to the URL at the top of the screen here, I'll read it as well. It's pollev.com/ARIELLINET000. It's only going to take 25 participants, but so you definitely don't have to feel compelled to do this, but I'm just curious to kind of get a feel starting out of where people are coming into this from. So if you want to participate, you can do that on your phone, on your computer, on your tablet. So I'll just give a brief period of time to see if people want to participate. I'm wondering if I'm not seeing any little things show up. So it's possible that nope, there you are. Oh, good job, guys. Great. So far, seems like most people who are participating are in a pretty good space today, which is great. I think it's really impressive, and we appreciate it that you're all here with us for an hour on a beautiful day when you have kids that you're trying to homeschool. So glad to see that most of you are at least the fairly green, happy, smiley face. And I'm going to move on to one more question, the second of three, actually. Just curious to get a bit of a sense of who's in the audience today. So you can actually participate in this one by text if you want, or on that website. And I'll just give a little bit of time for people to participate this way as well, just to get a sense of who's out there and help us tailor what we're saying to the attendees.
You had somebody also say that in the chat box, they're a case manager, which is
Nice.
another way to participate.
That's great. Okay, good. Well, it seems like we've mostly got other service providers, a few case managers. The poll doesn't show me, you're seeing what I see, so I don't know what the raw numbers are. And then a fair amount of parents and guardians as well. Didn't expect to have any young people, but we are always thinking about how to try to make our content more accessible to them, and we would love feedback about that after this. Last question for now, and then we're going to dive into the content. Just a brief phrase, sentence, blurb, anything like that. What do you hope to learn about today, or what is your biggest concern about home and community-based services? And as Carrie said, you could put that in the chat as well if you prefer.
While we wait, we also had a respite worker who is on as well.
Very cool.
Preschool
So I'll read out
BHP
some.
classroom teacher.
Oh,
Go
sorry,
ahead.
Carrie.
No, you just had a BHP and a classroom teacher.
Excellent. So concerns or contributions that people are sharing: access to technology and assistive technology at home. To be honest, we're probably not going to talk a ton about that, but we do know of some resources such as Maine site and others that we could share with you. So again, you can use that contact information we're going to share and reach out to us if you have specific questions about anything we don't get to today. Concern that providers aren't adapting to virtual fast enough, safety and health of children and families, access to needed services, ensuring we're keeping our staff and homes safe and making families feel comfortable and ensuring their safety, DRM's approach to completing on-site validations during this pandemic, and also how DRM can encourage social distancing when in the community, keeping my family safe with a new BHP entering our life, how to maximize his or her impact with my child while social distancing.
Awesome. So then in the chat box, you had how to restart community-based services in a safe way. We also have a juvenile community corrections worker joining us. I am hoping to get updates about Section 65 and Section 28 wait lists. And then it was just some individuals letting me know that they were here. Oh, wait, we go. Maybe one more. Sorry.
Give us that last one, Carrie, and then we'll move on.
I'm hoping to get updates about the Section 65 and 28 wait lists.
Yep, we will talk about wait lists. So let us move on at this point. And thank you so much for your participation. It really helps us. And can I move on? Okay, great. So what does Disability Rights Maine? We are part of the national network of protection and advocacy agencies for people with disabilities. So we work for Maine people, and we have counterparts in every state and US territory. And we work all over the state with people of all ages and needs in a variety of areas. So Katrina and I are the Children's Advocacy Program. Many of you may also know our colleagues Ben Jones and Atlee Riley, who are the special education attorneys. And then we have colleagues who work with adults with developmental disabilities, adults with mental health diagnoses, adults with brain injury. We have an ADA team, Americans with Disabilities Act, that works on employment discrimination, accessibility and public accommodations. We have a deaf services program, and we do other things as well that I'm not thinking of at the moment. So our website, drme.org, goes into more detail about the other things we do. We're going to focus today's presentation on children's advocacy, which is up to age 21 while receiving children's behavioral health services in Maine. So the two major things that we do in children's advocacy are helping kids access the services and treatment that they need outside the school setting and protecting their rights while they're receiving that treatment. So we do a lot of systemic advocacy, and we also do representation in individual cases. And young people with disabilities, which is a category we view really broadly, have the right to contact us and ask questions or for resources, no matter where they are, and they don't need guardian permission to reach out to us. I think that is all I'm going to say right now about what we do. But again, if you have other questions, put them in the chat. So there have been a couple of surveys so far of folks like you during this pandemic, and we did one, and then Maine Parent Federation, the Maine Developmental Disabilities Council, and the Autism Society of Maine did one together. And we all use this information to try to inform the work we're doing specifically during the pandemic. So I know that what's on your screen right now is pretty small. I will read to you a little bit, and then again, you're also going to get this PowerPoint. So the graph in the top left asks or graphs the answers to the question, have your children's services been suspended or reduced to the coronavirus pandemic? And as you'll see, I cut off the bottom of that graph, but it looks like about 70% of folks answered yes. And then that's the green. The smaller blue, that's about 20%, was no. And then there was a yellow group of less than 10% of my child or children were not receiving services prior to the pandemic. So most kids and family services were suspended or reduced due to the pandemic. And that very well may be the experience of those of you with us today as well. So then we have a graph of the answers of what services people's children were receiving. So the top bar is section 65. Below that, section 28 basic, and then section 28 specialized. Section 13, targeted case management, or I think behavioral health homes was lumped in there too. Below that, out of home placement, and then below that was other, or I'm not sure. So services from folks responding to that survey were varied. And then some narrative responses that folks shared about their home and community-based services, and without reading all of it, I'll just summarize that. Some people said their services were, if not the same, then about as good as they could have hoped for. Some weren't getting any services, some were getting reduced services, and people described more details about that to us. So then just briefly from the other survey, a lot of that was focused on education, but of the services outside of the school setting, 17% of folks said they needed individualized in-home supports and couldn't get them. And most wanted in-home supports to help with dealing with some type of challenging behavior. Also, a quarter of people responding to that survey had not been contacted by their case manager or their in-home supports provider. So having summarized the problem, we're going to talk a little bit about basic advocacy tips, which I think is the major reason most of you probably wanted to attend this presentation. One thing we want to let you know right up front is we're not as fortunate as our colleagues who work in special education. We don't have the IDEA. The world of advocacy for supports and services outside of education and in the rest of a child's life is much murkier. So Katrina and I are going to talk to you about some of the things that we do and the resources we use, but it requires maybe in some ways more creativity and at sometimes just more frustration when there isn't a good remedy, unfortunately. So we're sharing some resources here with you that are available to you in addition to contacting us and contacting Maine Parent Federation. If you don't have a case manager already, let me back up. These bullet points that I'm talking about are all Maine Care services. So I guess actually to jump to the bottom bullet point here if you don't have Maine Care, either if you have some other private insurance or for whatever reason you don't have Maine Care, it's hard because the major services and supports that are available in Maine for behavioral health for kids with disabilities are through Maine Care, and in some cases exclusively through Maine Care. So we're giving you a link here to a program called Katie Beckett, which is a way to apply for Maine Care if you don't income qualify, but your child needs services that are only available through Maine Care. Katie Beckett is a headache. I'm envisioning people grimacing out there. So just for you to know, that's a resource that's out there. It takes a long time. It can be difficult. And if you are looking for supports or having barriers with that, that would be a reason to reach out to us, to reach out to Maine Parent Federation, or to some of the other advocacy groups out there. But assuming you have Maine Care, which most of the folks we work with do, and you don't already have a case manager, that is pretty much the only Maine Care service that is self-referral. So you can just call and say that you would like a case manager, agency by agency. And so we're giving you a link to where you can find those agencies broken down by both mental health and developmental disability and by county. We also are giving you a bunch of contact information for folks who work at the state. So without getting too unnecessarily complicated, DHHS is the umbrella organization. And then the office that deals with all sorts of different children's related issues is the Office of Child and Family Services, which makes sense. So OCFS has several different branches under it, and the one that we're primarily concerned with is CBHS, which stands for Children's Behavioral Health Services. So that's not the same thing as child welfare or child protective. That's a different branch within OCFS. And that's not the same as child care, which is another function that OCFS oversees. But CBHS, it can be really helpful, particularly to reach out to the resource coordinators. So we've given you contact information in this PowerPoint, as well as job descriptions, so you can understand some of the different functions this office performs, because it can be confusing. But there are 3 resource coordinators for 3 regions of the state that OCFS has said families should reach out to and consider a resource if their child is not getting the services they need because they're on a wait list or they're having an issue either with finding a provider or with the provider they have. Also for waitlist issues, and we're going to talk more about what kinds of issues you might have with the waitlist, it can be important and helpful to reach out to KEPRO, which is the company that Maine Care contracts with to manage eligibility and enrollment. So again, can be a headache, but here is the phone number, and we're giving you the website here as well. I'm going to pause for a second and see if there are any questions that Carrie wants to lift up from the chat.
I think we're good. I am just providing the links in the chat box right now. I had a couple questions just about if kids were in special education, who do they contact for Disability Rights Maine, and I provided that information. And then there was a case manager who said that she's tried to reach out to a bunch of her clients and haven't heard from them for extended periods of time. And I just sort of said, we're hearing that as well from school districts. And parents are overwhelmed. So the best advice to case managers and providers are to please keep trying. But if your agency has protocols around, if you're concerned about the safety of children, you should be following those. And I know some school departments are using their resource officers in those cases to try to check on children. Then Carrie Anderson says, just recently found out that KEPRO is doing medical reviews now for Katie Beckett. Parents are saying this means they are now doing the medical reviews 2 times, once with DHHS, then the same information has to be resent to KEPRO. I have not heard that. Do you have any information on that?
I don't, but that is something that is helpful to, be aware of, and something that we can certainly lift up and see what more information we can find. It might be worth bringing up on some of the OCFS town hall weekly calls that I know you participate in, Carrie, and Katrina and I do as well. So that's helpful to know or to ask about.
Yeah, I mean, I haven't heard that, and my daughter has Katie Beckett, and I haven't experienced that. I've only experienced one medical review with KeyPro. There's also a financial review that you have to do. So I'm wondering so there's a financial review you do with DHHS, and typically the medical review is done with KeyPro. So yes, you do have to do 2 reviews a year, but one is a financial review and one's a medical review. That's what I've experienced. I have not experienced 2 medical reviews at this point in time.
Yeah, so we should, I mean, those are the kinds of things, it's definitely helpful to hear what folks are experiencing so we can try to gather more information and work through barriers that are popping up. So just wondering if there's anything that Katrina wants to add at this point.
I don't think so. Nope.
Nope. Okay. All right, then we'll move on. Oh, here are the resource coordinators I was mentioning. So we will be sharing the PowerPoint and you will have that. Okay, talking about the wait list. So for anybody who doesn't know, what is the wait list? There are actually several. And the names of the wait list to do with sections here, those are sections of a very long and complex document called the Maine Care Benefits Manual. So it just designates what these different kinds of services are called by Maine Care. So there's section 28, 2 different kinds, basic and specialized, and those are broadly services generally for kids with developmental and intellectual disabilities. Basic is just a BHP or behavioral health professional who comes into the home and works with the child and family on building skills. Specialized is evidence-based under the supervision of a board-certified behavior analyst who's working with the applied behavior analysis model. Sorry to throw so much jargon at you. And then section 65, or you might have also heard it referred to as HCT, home and community treatment, is generally for kids with mental health diagnoses, although you see kids on the section 28 list and the section 65 lists with a variety of different diagnoses, and a lot of times families and case managers will put kids on all 3 of those lists for home and community-based services because they're just hoping that they can get something, whatever, because under the thought that something is better than nothing. So those are the home and community-based services, and then section 97 is residential. I should back up. So the section 28 and 65 services are wait lists are maintained by Maine Care and KeyPro, and they are broken down by county, and the numbers are high and have consistently been high for a number of years now. So there are hundreds of kids waiting statewide, months and even years for these services, which is hugely problematic, and actually, as I put here, is inconsistent with Medicaid law. So Maine Care is the name of our state's Medicaid, and Medicaid law does not actually permit the existence of wait lists for children's services. So it's bad. It's bad on so many levels that so many Maine kids are waiting for the services they need that would allow them to be successful in their homes and communities, which is the least restrictive environment and where we want kids to be and to thrive. So then section 97 is residential treatment. You might also hear it called ITRT or iTreat or PNMI. And those wait lists are not maintained by the state. Every residential provider in the state, and I think we have 6 or 7 of them, maintains their own wait lists. And it's, frankly, it's not a transparent process. It's not clear how long people have been waiting, even necessarily who is waiting, and people are not served on a first come first served basis. So if there's a child waiting for residential treatment, that can be particularly confusing. And then it's the same for the psychiatric hospitals. So we have 4 psychiatric hospitals in Maine that serve kids. Spring Harbor and Acadia are the freestanding psychiatric hospitals, and then Northern Maine General in Fort Kent and St. Mary's in Lewiston are general hospitals that have attached inpatient pediatric psychiatric units. And the psych hospitals similarly maintain their own wait lists, similarly to residential providers, and that's also very confusing and hard to know where you stand. So that is the not so brief overview on what the wait lists are. And we want to talk a little bit about common problems with the wait lists, which are probably not news to many of you on this call.
Ariel, can I ask a quick question?
Yes, please.
So some of the providers are starting to reopen and some are continuing to stay closed. Say somebody has a provider and they heard of another provider that's providing services and are open and their provider's not, and they want to switch so that they can get their child services as soon as possible. Do you have any guidance as to what DHHS is saying about, because typically if you change providers, you go back on the wait list, on during this pandemic, if that would still be the protocol or if there would be exceptions made, or if you just haven't heard any guidance at all on that?
So I'm not, I'll try to answer your question, and then if Katrina has anything to add, she'll jump in, but I have not heard anything specific from the state to answer that question that you're asking. But to answer the question that you didn't ask, which is what would I tell a family under those circumstances, I do think, to the best of my understanding, it would mean going back on the wait list if you wanted to switch providers, and you could. So I didn't say this, but for each service, there's a general wait list, and then there's a family choice wait list, which is also sometimes called preferred provider. So for instance, somebody's child is eligible for Section 65. They know they only want to get it from Woodford's, and so they go on the wait list. They're specifically waiting for Woodford's. So if there's another provider that has an opening sooner, that child will get bypassed because they're not open to being served by another provider. So if, say you, Carrie, just as an example, your child was being served by Pathways, and during the pandemic, those services dropped off or declined or whatever, and you have heard maybe that Woodford's is providing services actively to your next door neighbor or something like that, you could ask to put your child back on the wait list, and you could say, I specifically want to wait for Woodford's, and you're playing this game, you're hoping that they're going to be able to pick it up because you've heard they're providing services.
And it's more likely that your provider ends up opening up and provide services prior to you coming off the wait list at this point in time.
I think sorry. No, just to jump in real quick, I think that what guidance was provided at the last town hall from the Office of Child and Family Services is that if you're a family who, does require in-person services and the provider you're matched with right now isn't providing those, that would be a reason to contact one of the resource coordinators, and that they would be able to connect you directly with a provider who is delivering in-person services, and hopefully try to bypass some of the challenges that you all just talked about around going back on the wait list and waiting another extraordinary amount of time for those services. I would say that also it's okay to call KEPRO. They have a member services line. They're the ones that you can call directly to get information about services that your child is receiving. And so if you're in a situation where you need services now, your provider isn't delivering them, reaching out to KEPRO, a resource coordinator, and also, of course, your case manager are all really good steps to take.
Thank you.
Excellent. So yeah, I would, I'm thinking, no. I thought that I might have some slides that were more specifically to what Carrie was just talking about, but some of the problems that I have on here aren't specific to the pandemic. So for instance, pitfalls in the assessment process. We know that the determination is made by KEPRO that a child is eligible for a certain service, and then they go on the wait list for that service. Their case manager places them on the wait list. And then a provider, ideally, hopefully, picks the child up off the wait list. May take 30 days to assess the child. And we'd love to hear from you if anybody's gone through that assessment process during the pandemic, because we don't know what that is like in these times. So please share that information if you have personal experience. But in general, a provider would pick you up off the wait list, conduct an assessment, and then they might say at the end of that 30-day period that they have, hopefully they don't take that long, but they might say, oh, we don't feel we can appropriately serve this child. Back on the wait list, which is really frustrating. We also know, unfortunately, this is not supposed to happen. This is sort of one of Katrina's pet peeves, but that providers in doing this assessment will sometimes say, okay, this child should get 15 hours a week, when it might really be that the child should get 25 hours of that service a week, but the provider knows they only have the ability to provide 15 hours. And so they're saying that that's what the child needs, because that assessment has kind of a limiting factor. So what providers should be doing is assessing what the child needs, determining how many hours they need, and then after that saying, and here's how many hours we can provide. Ideally, the full amount that the child needs, but if not, the child can go back on the wait list as partially served, and in theory, although it rarely happens, have more than one agency serving them at the same time. Or at minimum, it's our kind of position that the state needs to know when kids are partially served, because otherwise they won't have a real understanding of all of the need that's out there. So those are some. Are you unmuting because you want to say something, Katrina?
Yeah, I just want to say, again, this is probably an area that I could talk for a really long time about, but I think it's important to remember when developing your treatment plan that you're developing that based upon the full needs of your child and family, and that that's what is reflected in the treatment plan that goes to KEPRO. I think that oftentimes the treatment plan is developed based upon the capacity of the provider, and I understand why that might be, because you've waited so long to receive services. A provider says that they have 10 hours to provide to your child and your family, and so that's what the plan gets developed upon. But I think that causes such problem in truly understanding the needs of our families and kids across the state, because there are treatment plans that don't reflect the needs. So please make sure that your plans are reflective of your needs and not reflective of the capacity of the provider.
I also want to jump in and just say one of our participants, Carrie, makes a good point, and it's definitely a concern that I know Disability Rights Maine is thinking about, as well as Maine Parent Federation, that the need for these services are increasing because of the pandemic, and likewise, we had a shortage of individuals to provide the services prior to it, and we are feeling like we will continue to have a shortage, if not even more of a shortage, because those individuals that provide those in-home and community-based supports may not be comfortable continuing to provide them, and so the fear is the need will increase while the supply continues to be difficult to find. So, we have been present, as well as Disability Rights Maine, at all the OCFS and CBHS town halls, and we're trying to push that family voice at those meetings. And we have, I believe, moved the needle a little bit, and are making some progress. But they have acknowledged that those are their concerns as well moving forward as we continue to come as we continue to come out of this pandemic. Likewise, within our school districts, there is a high amount of concern around ed techs returning and even teachers returning within our school districts. So I think within the one-on-one type support area, those concerns are definitely being voiced and being explored as to what our options will be moving forward, but there are not any good answers at this point in time.
Yeah, I think you said it. I think you captured it really well, Carrie. I think that the person, did you say the person with the comment was also named Carrie?
Yeah,
okay.
It spells it the same way, which is awesome because I never find it spelled that way.
Well, I think that the Carrie who's commenting is exactly right at the intensity and magnitude of this problem. In children's behavioral health services, we were in a crisis before the pandemic, and now it's just like piling crises on top of each other, which is really disheartening.
Yeah.
And I think that you, Carrie Woodcock, are correct to say, you know, in my experience, that although systems folks are also aware of this problem, that we're not right around the corner from any kind of
An
solution.
answer. Yeah. One of our Facebook attendees said they experienced a family intake virtually for Section 28 and said it worked well, and the family is receiving remote services until it's appropriate to go back into the home, and the provider asked for the full amount. So that would be a virtual assessment for 28 services that one of our Facebook attendees experienced and said went well. I think it probably varies based on the family and the individual, just like virtual IEP meetings. So if it works great for a family and it's an option for families, great, use it. If you don't think it's going to work well for you, or you get into it and it's not working well for you, express that it's not working well. I think at this point in time, we need to get really good at asking for what we need. And it's great to give it a try, but if it's not working, say it's not working. And Carrie Anderson said, I've done many intakes with 28 the same way, worked with some, not with others. So yeah, I would agree, probably specific to the family, but it's great that it's being offered.
Yeah. And it's helpful to hear the input. So thank you. The last thing I wanted to say on this slide was just, we have lots of back and forth with the department about the process of managing the waitlist, and they are working on assessing that process. But one of the things that they continue to say that we continue to push back on, have just not gotten a resolution on, is whether the wait list should be opt-in or opt-out. So basically what we want to see is for the wait list to capture as many kids and families as possible. However, unfortunately, we know that people do fall off the wait list. So one of the things we would recommend, if your child is on one or all of the wait lists and has been for a while, is to call KeyPro periodically, or ask your case manager to call KeyPro periodically, because we've just seen some inaccurate information, even case managers being told that kids continue to be on the wait list and maintain their position on the wait list, and then it turns out later that's not true, or they've disappeared from the wait list. It's unclear why all of this is happening, unfortunately, but the best thing that we can advise with that is just to be vigilant. And we certainly talk to families who say, what is the point of even being on this wait list? We're not getting anything out of it. And you know, we're sympathetic to that, but we use those wait list numbers in our advocacy as well. So again, part of it goes back to just, if we're not capturing the scope of the problem, we're watching to see things like, are the waitlist numbers dropping significantly during this pandemic? If so, that suggests that people are falling off, because we know, or again, have heard and suspect that a lot of families aren't all of a sudden being served. So the data helps us try to ensure that we at least have a grasp of the problem. And you know, every once in a while, people do get picked up off the wait list. So if you want to be on the wait list, it's worth continuing to check that you actually are. I'm going to move on to, okay, so that was about accessing services. Now we're going to talk about issues with your existing services. So the first point here is that your child has rights. That link will take you to a lovely document called The Rights of Recipients of Mental Health Services Who Are Children in Need of Treatment. That just rolls off my tongue. We usually call it the Rights of Recipients for short. There is a companion document for adults. So just always be sure, if you are looking at it, that you're looking at the children's document. And that's where this link takes you. So those are state regulations that, again, cover Maine care services. So this document, just to tell you briefly, is divided into 3 sections. Part A applies to all services. Part B applies to inpatient and residential, and Part C applies to outpatient, including home and community-based. So there's a lot to say about the rights of recipients. There are some things about it that are really helpful. There are some things about it that are not as strong as we would like them to be. But we're just going to, in sort of the light of the pandemic, talk to you specifically about a couple of pieces.
Ariel, can I ask a specific question before you jump into that? Kendra was saying she has a client that's on Section 65 waitlist and was called by KeyPro. And we're told that if they didn't accept virtual, they would lose their spot on the waitlist. And Kendra says she did call KeyPro and that was not correct, and Mom was glad to hear that, but it was very upsetting that and caused additional stress. So it feels like KeyPro doesn't even know what's going on during this time. I think it's important to note that at this point in time, for any services for your child, if you are declining virtual, you do not lose your services. And that applies to special education as well, because we're hearing that from families as well. So I would just turn it over to Ariel and Katrina for anything they would like to add.
I'm so glad you brought that up, Kendra and Carrie. Thank you. First of all, again, it's just really helpful for us to hear these anecdotes so that we can lift this up. Secondly, I think it demonstrates what I was saying before, that when you hear some information from KeyPro and it doesn't sound right, you always want to double check and go back to the source. And it's so great to have case managers and others who can really advocate for their clients, because it would be truly terrible to just sort of accept that information and lose your child's services. So I'm glad to hear that was able to be resolved with KeyPro. But if there was a situation in which somebody was told that their child was going to lose their services because they weren't willing to have telehealth or whatever, those would be good reasons to reach out to us for potentially for our advocacy to maybe open an individual case on that issue. I would say from a practical perspective, if your child is either not willing to do telehealth or not able to do telehealth, what that might look like right now is sort of like a pause in services, because an agency might not be willing or able to send somebody into your home. So if I've spoken with families, for instance, whose children have medical conditions in which the parent doesn't feel comfortable having a BHP come into the house at this time. So for that family, telehealth or virtual might make sense, or for whatever reason, if it doesn't, then you're sort of just not getting services until something changes or it feels appropriate for something to change. But you shouldn't just be dropped from your services and put back on the wait list.
And Melody's kind of chiming in and saying that she thinks that might be referring specifically to providers in their own provider wait lists. And I would make the argument that providers can't do that either. What they need to do is wait till in-person services return and provide the in-person services when they return to those families that are choosing not to use virtual at this point in time. But it would be good from your provider to get clarification on that as well. And then I just had another question. I directed this person to the resource coordinators, but I wanted Ariel and Katrina to weigh in as well. If somebody's on the wait list, they've confirmed that they're on the wait list with KeyPro, yet it has been 16 months without service. They were also previously on the same wait list the year prior and fell off somehow. Who is the best contact to be reaching out to further regarding this long wait?
Yeah, I think you're right, Carrie, that that is the kind of situation in which the department has, as Katrina was saying, suggested to reach out to resource coordinators. But I want to be realistic with you all as well, to know that it's possible that there isn't anything, you're not going to be offered anything. And again, I just really want to go back and validate what I was saying before, that that's not right. That's not fair. That's a failure of the state of Maine on behalf of your child and the state's obligations to provide the treatment that it has deemed your child qualified for. And yet you have waited 16 months and might continue to wait. And and that's wrong, and that might also be what it is at the end of the day. But I definitely think reaching out to the resource coordinators would be a good thing to do in that situation.
So I want everybody to know that DRM, Disability Rights Maine, Developmental Disability Council, and Autism Society of Maine since this pandemic has been doing a lot of behind the scenes work. That's why you're getting a lot of surveys from us, but because that's the way we're going to hear your family concerns and provide your family voice. And that was what led the department to saying to us, you need to send these individuals to the resource coordinators. We're not hearing from them. And while it may not change your independent situation immediately, if we inundate the resource coordinators with phone calls and emails, it's going to bring to the state's attention that what we're talking about as agencies isn't things that we're making up. These are real stories that we're hearing from families. And so that's why we're flooding you with the resource coordinators information, because that's the direction the state has provided us with as to any individuals who have questions about these types of services or being on the wait list, whether it's pandemic related or not pandemic related. We need to be flooding these individuals with the concerns so they get an understanding. The state knows, yes, this is really happening. This isn't something that Disability Rights Maine or Maine Parent Federation, are making up. These are things that are happening in our homes and concerns of our families. And if you're worried about your anonymity and you want to maintain it, then contact us. We'll be happy to provide your story to those resource coordinators while maintaining your anonymity. And those are things that we're able to do through our surveys as well. But if you want your specific story heard and you're worried about somebody knowing exactly who you are and where you live, contact us. We'll put your story down and we'll make sure that we protect that but relay the message at the same point in time.
I don't know what happened with my screen sharing, but I'm gonna go back to it.
While you do that, I got a question. Are services being done face-to-face at this time anywhere? I'm a Section 65 worker whose children's center is looking to reopen face-to-face hands-on services on the 1st of June. Is this the norm for other agencies? I know that they were working on, OCFS is working on a list on who's providing live services right now, who's providing virtual services, and who's providing both. I don't know if that's been finalized in any way, shape, and form. Do you guys, have you seen that list yet? I know they were working
Carrie,
on it.
I think it's the list is really the survey went out to providers of Section 28 services and hasn't gone out to providers, I believe, of Section 65 services.
Okay.
And it's again, that list would be managed through the resource coordinator. And so they're the key to connecting with those in-person services. If that's something that a family needs, is reaching out to that resource coordinator. Again, don't want to set expectations that can't be met, but hopefully there are providers in your area that do have in-person services that you're able to access that way.
And I think this person particularly works for a provider. So just broadly to answer the question, it's our anecdotal understanding that there are some providers who are and have continued to provide in-home services. And then there are a lot that haven't been. So it just varies. And the state is, I think, slowly getting a grasp on what that all looks like. But to sort of go back to briefly to something I was saying before, and I'm conscious that we're getting close to the end of our hour. If your child needs in-home services needs a physical person to come into your house in order to make any meaning out of their services at all, that's something that your family wants and feels comfortable with, that would be something to reach out to the resource coordinator about if you can't get that need met. Because they're both, I think, educationally and outside of the educational setting, there will be children who can manage and get some benefit out of telehealth or virtual services, and then there will be some who just can't. So that's an important need to raise up, and there would be ways to sort of advocate for that using clinical documentation that your child might have from their history. So those are cases where you might reach out to us for advocacy help if you need that as well, and we can take a look and see if we can help. So I wanted to just make sure we spend a few minutes before we have to wrap up on what I was starting to talk about with the rights of recipients, and then I was just going to briefly mention the grievance process. I'm going to take a breath. So no matter what kind of service your child is receiving, whether it's residential, hospitalization, crisis unit, outpatient, home and community-based, they have the right to individualized treatment. And this is one of the biggest things that Katrina and I spend our time advocating on, that your child should not have the same treatment plan as any other child receiving that service from that provider. It shouldn't be cookie cutter, and you shouldn't be getting the rationale for anything. This is how, well, I'm sure there could be examples, but in general, you shouldn't be getting the rationale. This is how we do it. It really should be that your child's needs and strengths are driving their treatment. So you all, I'm sure, know, if you've been receiving these services, that every 90 days, typically you have a review of your child's treatment plan, but it's the rules and rights say that it's at least every 90 days, or as I put on here, as necessary to address substantial changes in the recipient's life. Well, we've all had substantial changes in our lives over the past few months. So it's very likely that the treatment plan and the treatment approach that was being used with your child prior to the pandemic may not work the same now. Your child's needs may have changed. Certainly your child's daily schedule has likely changed. So if at this time, if it's not time for your 90-day review, but you feel my child's behaviors or needs have changed, and that indicates that maybe we need to bring the treatment team together and talk about how to adjust based on those changes, then that's something you can ask for, and that's something you should be entitled to. So we want to empower you with that knowledge and make you aware that that's something that you could reach out to us for assistance with if you are not able to get that need met. You also have access to the grievance process. I know this form that I put on here just for you to kind of get a snapshot of it is very small, and you probably can't read it now, and that's fine. We're giving you the link to where the form is and more information about the grievance process. We just want to make you aware that a grievance, which is another word for a written complaint, is one avenue you can use if you're having issues with your child's provider. It's often better to try to resolve things informally first, but if you can't do that or it's not successful, you actually have two grievance options. Whichever agency you're working with, they're required to have their own grievance process. So you could file a grievance with them. They should have a form, and that would go internally through whatever chain they have with their agency. And if that doesn't work out, then you could use this grievance process with the state, or you could just go straight to this grievance process with the state. So you fill out this form, submit it as indicated on the form, and you can request either mediation or an administrative hearing. If you have mediation and it doesn't work, you can have an administrative hearing afterwards. But if you have a hearing and that doesn't work out in your favor, you can't then go back and do mediation. So I don't want to get too bogged down in the weeds of it. You can file a grievance for pretty much any concern you have with the services that are being provided, any decision you want to challenge, any absence of something that you think should be there. And those are matters that we help with as well. There's also main care grievance. So if your child's services have been reduced, terminated, or denied by main care, you can file a grievance, and there are some really important timeframes on that. So you want to do that quickly and reach out to us quickly if you do have questions about that. But that is different from your provider reducing, terminating, or denying you services. So main care might say, yes, your child is eligible for Section 28, and yes, we'll approve and pay for 30 hours a week. But your provider might say, we can't provide that many hours, or we don't think that many hours is appropriate, or whatever it is, and that you have to address directly with the provider. But if you get a notice from main care that says, oh, you've been getting 30 hours a week all this time, and now we're only willing to pay for 15 hours a week, that's something that you would appeal with main care. So I know this can be pretty confusing. If you're in a situation and you're not sure what's right, you should talk to your case manager. You can reach out to us. Just want to make you aware of some of these options that exist.
There's just a question.
Yes.
There was a question if there was an equivalent grievance form for on the adult side of things, and I've put the link in the chat box of the grievance process for adults through the Office of Aging and Disability Services for those of you as well.
And
That's
just
great.
to add that there's also an adult rights of recipients, as Ariel was referencing. So, you know, there's both for children's as well as for adults. So I don't know if we can throw that link in there. I can try to find it as well, Carrie.
Yes, and as Carrie was saying, there's an ODS grievance. There's also an OBH grievance. So adults would either be getting developmental services through ODS, or they might be getting mental health services through the Office of Behavioral Health, which used to be SAMS until very recently, and they have a grievance as well. So you can reach out to any of our agencies if you're not able to find the information that you need on those topics.
I got it, Katrina.
Before we conclude, I guess Carrie's going to share that with you. Before we conclude, I'm just curious to try our, ooh, I have to clear this. Let's see. Yes, okay. I'm curious to see if our faces have changed, although to be honest, you guys were pretty positive at the beginning. So I don't know if we could take much credit unless things have gotten really bad ever since we started talking, in which case I'll be sorry I did this. But just curious if you want to share again at the end how you're feeling, and then our PowerPoint will be over and I will turn it back over to Carrie with 2 minutes to spare.
Yeah, and if I'm gonna launch a poll for us as well. We are federally funded, so if you could just take a few minutes to answer, I think it's 8 questions. That would be great, and we will hang out while you do that to be able to answer any additional questions that may pop up. Right now I'm not seeing any, but take a few minutes to fill out the poll and we'll hang out. If you have any questions for Ariel or Katrina while we wait, feel free to pop them in the chat box or in the question and answer box. I want to thank Ariel and Katrina for their time today. As we all know, Zoom meetings are getting fatigued really quickly, and but it's the only way to connect and provide our families with information. And so I really appreciate the collaboration with us to be able to provide this information to our families and the professionals who work with them. I think what's happening right now and what we're seeing is that our children with very high needs are able to have access to the virtual and distance learning at school, and they're also not able to have access to their in-home supports, and those behaviors are increasing, and the safety of our families is a concern, and the regression that those children are experiencing is a concern. And we don't want to say to our families, crisis is your only option, because it shouldn't be our family's only option. And that's why it's important for us to hear from you as families, so that we can make sure we're voicing that to our Department of Health and Human Services, but then also to provide you some alternatives to just that one option. So thank you guys for your time today. It was very informative.
Thank you for having us, Carrie and Dylan, and thank you all for attending and participating and asking questions and bearing with us.
No, I think you probably saw my family pass through a couple times during the process. I was telling Ariel and Katrina prior to the webinar starting that it has gone from mummy's in a meeting to how can I Zoom bomb mummy during a meeting. It's not so much tiptoeing around anymore, but that's been the shape of this pandemic, I think, that we're all experiencing. And so we're all grateful for the ability to be able to connect, even if it means that you're seeing an open pantry behind me, or me in my running clothes still, because that's my escape right now. So I see, Ariel, you put in DRM's online intake form. Thank you. We're just getting a bunch of thank yous. Thank you for taking the time to have the discussion today, and great information. And so we will hang out for just a few minutes longer. If you can just take some additional time to complete the poll, that would be great. And if you've done that and you don't have any questions, then at this point, I don't think we have anything else to offer. If you want to hang out just to see if there are any other questions that get asked, you can feel free to do so. We'll just wait for a few more moments. So thank you again for joining us today on what is a beautiful day. I think Mother Nature's finally starting to cooperate with our pandemic. I'm very excited for 80 degrees on Friday. I'm not seeing any questions as of yet, and we're just give it another minute or so. Typically what ends up happening, yeah, we're seeing people drop off, so. Oops. Ariel and Katrina, I'll share the poll results with you as well.
Thank you.
Yeah, as well as the number of attendees and that sort of information for your numbers. So
There's a
Melinda,
question
I'm
about if
seeing
it's
a
going to be
question.
available.
yes,
Oh,
so
sorry.
the recording, nope, the recording, we've recorded it live. We did a live stream on Facebook, and that records it, and we'll get it up as soon as we end for the most part. And then we will get it up on YouTube and on our website in the next couple days. On our website, there'll be a link to the PowerPoint that was provided. And then on YouTube, it is closed captioned as well. And so you will be able to see the recording on our website, on YouTube, and Facebook. It'll be available today. And all of our, you can find all of our webinars in that format in those 3 places. So we're doing lots of collaboration with many different agencies. For those of you that were asking questions about adult services, we are working with attorney Stacey Converse from Disability Rights Maine, as well as Alan Kurtz, who's a professor up at UMO, to provide some information on adult services and getting access to technology. So we don't have a date and time for that one yet, but stay posted on that one. And so I think.
And there's one on your website with our colleagues, Ben and Atlee, on
Yes.
special education services that anyone who missed it could go back and watch.
Yeah, and as this is an evolving process, especially with the schools, we are working to continue to provide updates. And I think probably the end of June, we'll look to do another special education update, just so that you can have an update on extended school year services as well as the fall. So stay tuned. So with that, I think we're gonna go ahead and end the webinar. I don't see any other questions. The polling's been completed. Thank you, ladies, for joining us. I really appreciate your time. Thank you, all of you who joined us today.
Enjoy the
hope you
beautiful day.
Yes, enjoy the sunshine. Bye.